We obtained an email yesterday that was sent out by their CEO to all employees saying, after significant deliberation and consultation with internal and external experts, including our physicians, we've made the difficult decision to pause gender-affirming surgical treatment for patients under the age of 19 in our hospitals and surgical centers. So, first of all, great news. But there's a lot of buts to that. First of all, they're saying pause. So it's going to start at the end of August. They're calling it a pause. So we've got to go through, 5 more weeks of child gender mutilation at all Kaiser Permanente facilities until the end of August. That seems a little bit ridiculous. And then is it a pause until Donald Trump isn't in office anymore? And then what happens in 2028 if a Democrat is elected? Are they going to very quickly restart these? I hope not. We'll talk more about that in a moment. But again, that word, a lot of you guys online when we broke this news yesterday centered in on that difficult decision. Them calling it a difficult decision. It shouldn't be a difficult decision at this stage. It really should not. And I think one of the frustrating things about this difficult decision is that they haven't reached it because the science isn't on their side. They haven't come to this conclusion because a lot of European countries backed away from performing life-altering surgeries on children. They haven't reached this decision because public opinion isn't on their side. They've reached this decision because Donald Trump threatened to take a bunch of money from them. So while it's difficult, they have to do it anyway. They said since January, there has been significant focus by the federal government on gender-affirming care, specifically for patients under the age of 19. This has included executive orders instructing federal agencies to take actions to curtail access and restrict funding for gender-affirming care. We must carefully consider the significant risks being created for health systems, clinicians, and patients. So they're worried about the money. I'll take it. Look, I'll freaking take it. I don't care if you don't, on all of these things. DEI, anything involving radical gender ideology, surgical interventions for children, boys planning, all this dumb stuff, right? That they should very easily be able to walk away from, but for some reason they just can't. I'll take it if they have to feel pressured from President Donald Trump. But apparently we're a long way from these people who are supposed to care about their patients' health and well-being, realizing that they are mutilating little kids. And to be fair, and I've said this on the show before, it's not the first time that you've heard this from me, it is one of the most disgusting positions I've ever held as a political commentator in the early days of doing this show, where I felt like, I'm all for parental rights. So if a parent decides that they want their child to have their healthy breast cut off or their genitals cut off, can I really say no? I regret that position a lot, and I've expressed it many times, that I use this platform to push such an asinine position, because of course there's a lot of things that parents can't just do to or with their kids because there's laws around it. There should be a law against this. So I'm not acting like I'm holier than thou and I've always held the right position on this. Now I realize it's very obviously the right position. So I'm not going to shame anyone who comes around. Who am I? I'm not going to shame anyone. If Democratic leaders, if Kaiser Permanente, if any of these entities, even doctors who've performed these mutilations want to come around and say this was the wrong thing to do, who am I to say, to shame you for coming around too late when I had to come around on the issue myself? But they're not coming around on the issue. They're just scared of losing money. So, that's where we're at right now. And they're not going to end all of this gender care for kids. They said in this email, all other gender-affirming care treatment remains available. We will work closely with each patient to support their care journey. We will remain a voice and advocate for safe, high-quality, and evidence-based care for patients. They go on to say, Kaiser Permanente is dedicated to providing safe, high-quality, and evidence-based care to all our members, including adolescents. It's like none of those words apply. Safe, high quality, evidence-based, none of that applies to these gender mutilations. It says, we're proud of the care and coverage we provide our transgender patients. So they're proud of this. They're proud of it. I got a message, I just wanted to read you really quick, from a friend of mine who works for Kaiser Permanente in a healthcare capacity. Said, the fact that the company I work for says it was a difficult decision to pause these surgeries on minors makes me want to quit. It embarrasses me to work for an organization like that, though I'm not specifically involved in gender-affirming care in any way. And I don't think it's too specific to say that this friend of mine is a doctor and works for Kaiser Permanente. and says, in seeing this comment, when they said it was a difficult decision, it makes her want to quit her job. And that's what we need. We need more doctors standing up and saying, hey, this isn't right. And I mean, when we had the therapist from Multicare quit her job, or was she kind of fired? I guess she was sort of pushed out the door because she came out publicly and spoke out against these, not just, it wasn't specifically child mutilation. It was like, you're just fast tracking these kids who come in to a gender clinic without making sure they're going through necessary therapy to try to figure out, like, why do they feel this way? What's going on with them? It was just like, nope, can't question a child that comes in and says they think they're something else, and just send them to the gender clinic so they can get care that's going to alter the course of their lives. And, Tamara Pitsky paid for that with her job, and she's now working in a private practice, which hopefully is going better for her. So yeah, I think there are going to have to be more people who come out and sacrifice their careers over it, unfortunately. But either way, this is a win. So we're going to have at least a pause from all these hospitals and clinics across the country and mutilating children. They're going to keep mutilating them for 5 more weeks, though. And then who knows what will happen after President Donald Trump. But I'm looking for more dominoes to fall here. If Kaiser Permanente did it, maybe that'll allow for some other medical facilities to just use that and say, hey, Trump, money, whatever it is, we've got to stop doing these kids. And I'll take that for the time being.